Kathy,
Yes.
you are 73 years old and have lived with cerebral palsy your whole life since you were born 3 months prematurely. Tell me about how the cerebral palsy affects you.
Well, in my case, it affects my legs and my feet. They are really tight sometimes, and they're really stiff, and it's hard for me to make them move the way I want them to move. Sometimes they don't want to move, and I just have to take movements slow and easy, and then they move a little bit better. And it also has affected my hands just a little bit. I don't do things very well where I have to pick up tiny little things, but otherwise my hands seem to be okay.
Are you able to walk?
Yes, I can walk, but I have an awkward walk, and I need to use a walker at this point. But I did not always need to use a walker, but I do now.
Tell me about what you've done in your life.
Well, at first I didn't know if I could really do anything, because when you're born with this, you don't know what you can do. And nobody else knows what you can do either to start with until you see people when they evaluate you. But what I was able to do is I was able to get through public school, and I was able to go to college, and I graduated with honors, and I became a licensed clinical social worker. And what licensed clinical social workers do is we help people that come to us when they're having some problems that cause them some emotional pain and they don't know what to do about it. And we help them come up with solutions where there are solutions, and if there aren't any, we help them live with whatever is causing them trouble a little bit easier.
That sounds quite rewarding.
It's very rewarding. Some people's lives change for the better, and if we had a little small part in that, that's terrific.
That's great. Some people see having cerebral palsy as being awful, but I understand that you see it more as being a challenge.
Oh, it is a challenge, and a challenge is wonderful, because what a challenge means is that you're facing a hard thing. Cerebral palsy can be difficult because you don't move the way you want to. It's sometimes painful. Some people have pain. Not everybody does, but some people do, and it can be very frustrating. But the reason it's a challenge and not something totally awful is because you can get better. You can improve. Nobody can take cerebral palsy away. We don't know how to do that yet. But you can improve your movements when you see doctors and therapists that can help you. They're trained to do that. And they'll give you things to do, and if you do them, and if you practice, you get better.
I work with kids who have cerebral palsy. What advice would you give to a 10-year-old or a 12-year-old or a 15-year-old who has cerebral palsy?
I would say that if you're seeing doctors or if you're seeing therapists, do your very best to do what they suggest you do. And that is not always easy, because sometimes you don't feel like it. Sometimes you don't want to see anybody, because then you think you might be weird because you have to see somebody, or you think other people are going to think you're weird. But these people are here to help, and I would suggest that if you're seeing those people, that you do your best to follow instructions, and you realize that there's much more to you than just cerebral palsy. There are lots of other things about you that are terrific, and you can get better with practice and time. But you got to realize it's going to take a lot of time.
You have compared having cerebral palsy to being an athlete.
That's true.
Tell me more about that.
Well, when you're an athlete, you usually want to excel at some sport. It's football or basketball or baseball or swimming or skiing or hiking or kayaking. You can name a bunch of them. And you don't start out doing all of those things really well. You might move really well when you walk or when you're going through your everyday life, but if you want to get good at sports, you got to practice. And that's exactly what people with cerebral palsy have to do too. And the other way that we're the same is athletes have coaches. They don't know how to do everything perfectly. In fact, they start out pretty badly sometimes, but they practice and practice and practice, and they get really good. And that's why people like to watch them. And if you have cerebral palsy, your therapists and your teachers are your coaches, and they help you get better too.
That's a fabulous comparison. Tell me about some of the social challenges of having cerebral palsy.
Well, there are a lot of people who don't even know what cerebral palsy is. They've never heard of it. They don't know what, and they see that you're different because they see that you move differently. Some of them are really uncomfortable with people with any kind of disability. And so one of the things that they might do, the first thing that most people have to go through if they have cerebral palsy is other people stare at you sometimes. Now that's considered to be a rude behavior, but some of them can't help themselves. And if you watch them, they might be staring at you, your whole body, or they might be staring at the part of you that doesn't move well. In my case, I've seen people staring at my legs. Sometimes they stare at me, but they stare at my legs. And I can see by the look on their face that they wonder what's wrong. That can happen. And when that does happen, you can do a couple of things about that. If you don't know the person very well, and you're probably never going to see them again, then the best thing is probably to do nothing, just pass by. But if you're going to see them a lot, and you're reasonably sure if you talk to them, they're going to be okay with that, they're not going to start any kind of argument or anything, then you can go up to them and say, do you have a question for me? Or is there anything that you want to say to me? And sometimes they will ask questions and you can answer them. Sometimes they will say something, but a lot of times they just turn their heads. And if they do, they don't want to talk about it. You gave them the chance.
What would you tell a kid who's being teased because they have cerebral palsy or because they're different?
Well, I would tell them, first of all, that it depends on the kind of teasing you're getting. With some people, they're teasing and they like you. So they might tease you a little bit about being different. But if they like you and that they don't mean you any harm, then if you have a sense of humor, you might kind of tease back or whatever. You can do that. But if they tease you and they're trying to be mean, they don't usually stop if you ask them to. You can certainly ask them to, but they might not stop. And if they keep teasing, and if they won't leave you alone, and or if they make fun of you, I think you really need to tell somebody. And I know you probably don't want to do that because you're afraid that if you do that, they're going to do it even more. But the problem is, if you get teased or people make fun of you and they don't leave you alone, they don't stop there sometimes. They might walk by you and shove you a little bit, or they might pinch you a little bit. They might think that's okay. It's not okay. Tell somebody. And if the first person you tell doesn't respond very well, then tell somebody else or somebody else or somebody else. It could be your parents. It could be an aunt or uncle. It could be somebody in your church or your synagogue. It could be anybody that you know is on your side who probably is going to help you through this. And you need to tell your teachers too.
It's very helpful. Thank you.